you see that variety, but it really is a change in how, in the hospital, you've got a lot of colleagues around you, you've got nursing staff that support you, you've got the allied health there if you need them, and obviously you're more senior doctors. It is quite a change when you come into general practice because it's just you in the room with your patient. And it can be initially sort of a bit daunting, I think, sometimes. And you need to be prepared that it's a different way of practicing medicine. It can take a little while. And the other thing that I think sometimes can maybe concern, people thinking about general practice is that uncertainty that you don't know what's coming through your door, and a bit like an ED department, maybe not quite as acute as EDs. Sometimes it is, but you don't know what you're going to be seeing next. And for some people, they can initially struggle with that level of uncertainty and not knowing really what the patient's going to be coming.
Yeah, I'd imagine having that you've got a much more direct responsibility. Like you'd still be working, I guess, as a team, but it's a very different kind of teamwork, isn't it? Because in a hospital setting, you'll be working in consultation with others, and you'll often be getting other opinions, and there'll be a lot more collaboration. Whereas in GP, you might have a much more direct interaction with the patient and in terms of the decision making, right?
Yeah, you do. And of course, though, as a GP registrar, you've got your supervisor and your other GPs that you can talk to and seek advice. There's no problem with that. But nonetheless, when you're in that room and the door gets shut,
it's just you and the patient.
It's just you and the patient. And that's quite different to being in a ward and looking after people. There's always somebody around. There's not often, there are private rooms, obviously, in hospitals too, but it is a different kind of feel. And sometimes initially, I think, some GP registrars can find that a bit challenging, and not having that support network kind of as visible, perhaps. It is there, but it may just be in a different way, and you just need to acknowledge and accept that it is in a different way, and that you can still seek all that help. And even though the way general practice set up is not as conducive to feeling like you can always do that. So I think you just need to understand that the support is always there still. It just looks a little different. Yeah,
the setting itself, I guess, just plays out differently. Yeah.
And that uncertainty. And the other thing about uncertainty in general practice is that you often end a consultation with uncertainty. you haven't always solved everything in one consult. Whereas in the hospital, if an inpatient, for example, they stay there and you might be waiting for results and so forth. But in general practice, you might actually send somebody out the door, still not really sure what's going on. Because you've got to wait back. You've got to wait for some results to come back. You've got to wait for, maybe the evolution of something. And for some people, that initially can be quite challenging too. And it's getting used to and getting comfortable with that uncertainty. Of course, you've made sure you haven't missed any red flags that need urgent attention and all of that. But it can be sometimes hard for people, especially for us as medicos who want to solve things and want to know that we've made a diagnosis and we've done this.
I never thought about that reality of it, because you kind of just think that like the job of a doctor is to fix the problems, like they fix health problems. And it's not that you're not fixing problems. It's just that some problems take time. And as you said, sometimes you have to wait for test results or for more evidence to support a particular theory before you go kind of gung-ho with it, so to speak. I never really contemplated that. That would definitely take some adjusting to. That would be one of the unique elements of GP work, I guess, compared to hospital work. But it's just getting used to the difference when you're first as a junior doctor, as a registrar coming into that kind of practice. Obviously, for us who've been doing this for many years, that is the way of general practice, and you get used to that and you accept that, and it's fine. But it can be a trap for young players, perhaps. Well, that's good to know. Yeah,
that they might feel they should have made a diagnosis. They must be doing something wrong if they haven't by the time the end of the
but it's just part and parcel of the way that it works.